ISS versus ISE versus CSS versus CSE key differences. 4 reports, 2 focuses, 1 goal, regulatory excellence. Now, ISS versus ISE versus CSS versus CSE key differences and why it is important in pharma industry. It is important because it is required for regulatory approval. It codes documents in eCTD submission. It ensures patient safety, comprehensive safety evaluation reduces risk, proves treatment benefit, strong efficacy evidence, supports product value, builds trust and credibility, transparent, consistent, and science-based evidence, supports global market access needed by FDA, EMA, and other health authorities, guides better clinical decisions, helps HCPs, patients, and stakeholders. Now, there are few aspects here for these 4 terminologies. Here we have main focus, scope, outcome, CTD module, purpose, and primary audience. So this is what I'm going to talk about today. Now, ISS is an integrated summary of safety. The main focus is related to safety. It's a detailed integrated analysis across multiple trials. Say I have 12 multiple clinical trials. I want to combine into one single submission. So all these 12 clinical trial studies, they will be combined either vertically or horizontally based on the availability of data, how it can be mapped, and then whether it's a CDISC or a non-CDISC submission, the required format respect related to SDTM specs, ADAM specs, and SDTM datasets and ADAM datasets that can be done. Now, there are 2 possible ways of doing it. Either you combine all the 12 individual clinical trial studies data into one by ensuring that there is an harmonization in the data structure, or you simply take the individual studies 12 and convert each and every individual study into a harmonized data structure, so that in the end you just need to append the data either vertically or horizontally. Now these are the 2 ways of doing it. Now whenever you work on ISS and ISE studies, it's always a tedious and a daunting job. The reason is you have more than 1 or 2 clinical trial studies. So say I have 10 to 12 studies. So in that scenario, the very first thing is you need to ensure the data is in good structure as per the CDISC or a non-CDISC format. Even if it's a non-CDISC format, you need to ensure the variables, attributes, then the column length, then the variable names, and the data that is being captured. So in some study data will be there, in other studies the data is not there, and that study has already closed. So whom do you contact? So these are all our various questions when you work in ISS and ISE studies, and you will come across various common challenges when you work on this. Hence it's a very detailed and a time consuming and a daunting job when you work within ISS. But if you follow certain rules in terms of precision, in terms of attention to detailed minute points, and you plan accordingly, and if you do the harmonization in a better way, in a smart way, and if you try to combine, everything will fall in its own place and you will be able to finish the task. So that's how the dedication is needed when you work on ISS and ISE study, because one single mistake while combining the multiple studies, say 10 to 12 studies, can lead to huge losses. So the output is in in-depth integrated analysis. The CTD module is 5. The purpose is comprehensive and safety evaluation, whereas primary audience is regulators and scientific experts. Now, ISE is integrated summary of efficacy. Main focus is related to efficacy parameters. Scope is detailed, integrated analysis across multiple studies. Integration is nothing but combination, like combining, right? Multiple trials. So the same explanation which I gave for ISS, the same applies to ISE, though only the domain changes from safety to efficacy. So the same explanation which I gave for safety, it applies to efficacy also whenever you have efficacy domains. So the output is in-depth integrated analysis. CTD module is 5. Purpose is comprehensive efficacy evaluation, and primary audience is regulators and scientific experts. Now, CSS is clinical summary of safety. The main focus is related to safety. Scope is concise summary across all trials. So say there are 10 to 12 clinical trial studies and you want a summary. Now when you do the summary or a narrative, it becomes very easy. You don't need to dig into each and every stuff. Even though it could be little bit difficult, but I don't think it could be that much efforts that you need to do. So when you work on CSE, it's just a concise summary is nothing but a narrative summary that you need to submit. So the output is high level summary and interpretation. So whenever you do the summary for any kind of parameters or any kind of endpoint, you need to also mention its interpretation, right? So the CTD module is 2. It's a quick overview of safety findings. Now since it's a quick overview, so you just need to pick up the main points or the main parameters. You need not analyze each and every stuff in detail in explanation, so it would be very easy to work on CSS and CSE studies. And the primary audience is regulators, non-technical summary, which are not from the technical background, right? So for the common layman people, whosoever want to understand. CSE is a clinical summary of efficacy. The main focus is related to efficacy endpoints or parameters. Scope is concise summary across all trials. The same explanation which I gave for CSS, it same applies to CSE. The reason is only difference is only the efficacy part. Output is high level summary and interpretation. CTD module is 2. Quick overview of efficacy findings, whether the clinical trial is having a good narrative so that the better interpretation can be given, so guidance can be given as to how this molecule is going to work in the market. So these are all our quick findings that needs to be submitted to regulators, which are non-technical summary. So this is what is the key differences between these two four terminologies. And in short, ISS and ISE is a detailed proof of safety and efficacy. It's a combination of multiple clinical trials, whereas CSS and CSE is clear summary for regulators, just a narrative, right? So together they enable safe, effective and global approved medicines. So these are very important in pharma industry, and you should know as to how these terminologies help getting the good medicines or getting the good picture of the molecule for the patient, so that it gives a better and a healthy environment in population. Many thanks for watching my video and happy learning. Please like, share, subscribe, leave a feedback comment. Many thanks for your support and having great connection.